Thank you, everyone. So just a little bit about me and what I do. I am a breastfeeding counsellor with the Australian Breastfeeding Association, and I'm a mother of two as well. So I've been a breastfeeding counsellor for nearly 5 years, and we are all volunteers with the Australian Breastfeeding Association. The Australian Breastfeeding Association is Australia's largest breastfeeding information and support service. So we do a lot of different things around Australia. We have a 24-hour helpline, which is staffed by all of our volunteers around the country. We have local support groups, so all of you can come across to our stand and get some details for your local group where you can go along and you can meet other parents. And it's really great to do that, meet someone who has been there and done that, what you're about to go through. We also have breastfeeding education classes. So a lot of the information that I will be talking about today is from our breastfeeding education classes. It is very condensed what I'll be talking about today because our classes go for around 3 hours. So if you would like to come across to see us at our stand, we are down up against the wall over there. We can book you into a breastfeeding education class and you can get a lot more detailed information. So the first thing that I'll be talking about is something that a lot of you might have heard about at your antenatal appointments, and that is why breastfeed. So it's something that is covered a lot in Australia. We know that in Australia the percentage of parents who start breastfeeding is very, very high. It's over 95%. So in Australia, we've got most parents do want to breastfeed in Australia. So some of the biggest reasons that we're given from parents for why they want to breastfeed is because of the immunity factors that are in breast milk. So when you're exposed to something, an illness or something, your body will make antibodies and they will pass through your breast milk. So it's actually specific to what you've been exposed to, which is a really positive thing for your baby. So there's a lot of other reasons that we don't really have enough time to go into, but there's a lot of information on our website about the health outcomes that are associated with breastfeeding as well. So the next thing I'm going to talk about is how breastfeeding works. So this is a really important thing for breastfeeding parents to know, because if there's something going on and you think you need help with, knowing how everything works is going to be really helpful for you. So has anyone here heard of the letdown reflex? No. Okay, fantastic. So the letdown reflex is basically something that makes your milk available to your baby. So there's always milk being made in your breasts, okay? But the letdown reflex is what means the milk get pushed out. So if you've ever seen a picture of milk squirting, that's what it is. It's the letdown reflex. So what happens is your baby will suck at your breast, and that will send a hormone response up to your brain, which will then tell the milk to come down. Okay, so some people describe the feeling that comes along with a letdown reflex as a pins and needles or tingling. It can be a little bit painful, especially in the first few weeks, but not excessively painful. But not everybody will feel it. Sometimes the only sign of a letdown reflex that you'll have is because you'll see that your baby will change the way that they're sucking. So when your baby goes onto the breast, they will suck very fast and go suck, 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 suck. And then the letdown will happen. You'll see the sucking and swallowing starting to happen as well. So they'll slow down, nice long, slow sucks, and you'll see them pausing in between, and that's when they're swallowing. So that's a really good way to know when your baby is getting milk at the breast as well. So the other thing about how breastfeeding works is the big thing that a lot of you have heard about is supply and demand. Okay, so your body will make, the amount of milk that your body makes is set by the amount of milk your baby will remove from your breasts. Okay, so if you are giving your baby free access to the breast, then in most cases your body will make the exact perfect amount that your baby needs. Okay, so I'm going to talk a little bit about positioning and attachment. I'm just going to go through and find there's a couple of slides here. Okay. That one. Okay, so one of the things that we say for positioning and attachment is chest to chest and chin to breast. All right, so with this you can see that the baby's chin here is tucked into the breast. And if you look at the shape of baby's lips here, this is really important. So we call this either the fish lips or we call it Special K lips, which is based on, you can imagine a box of Special K, the logo that's on the front of it, that's what the baby's lips look like. All right, so you can see that we want baby to have a nice big mouthful of breast. We don't want them to just be on the end of the nipple because then they won't be able to effectively get the milk out. So getting positioning and attachment right is really important for quite a few reasons. One of them is because they will be able to more effectively get milk out of the breast if they've got a larger amount of the breast. So we don't want them just on the end of the nipple. You can see that actually they've got a big mouthful of areola in there as well. So one of the other things that is really important for positioning and attachment is to make sure, there's me, that's my baby. Okay, this is a crying baby. What we notice about the baby's tongue is it's up. Okay, so what we want to see when we're putting a baby onto the breast is we want their tongue to drop down. So if you are able to feed your baby before they get to this stage where they're crying, let me go back again, and you're feeding your baby when they show sort of earlier signs of being hungry, so they might be sort of putting their hands in their mouth, or they might be sort of just starting to grizzle a little bit before they're really crying, then you'll be able to get your breast into your baby's mouth more effectively than if their tongue is up like this. So we've actually got some pictures that we can give you over on our stand if you want to come over and see us. We've got a tear-off pad that shows in images what the signs are of baby being early hunger signs. Okay, so there's a few different positions that are really good for breastfeeding. There's one slide in here where we can see breastfeeding lying down somewhere. So breastfeeding while you're lying down, that one there, is a really nice way of just getting a little bit of rest in while you're feeding your baby. Newborn babies feed really often. Okay, does anyone know how many times over 24 hours a baby might want to feed? No? The number's usually around 8 to 12. Okay, so that's roughly what you're aiming for. Okay, sometimes a newborn baby will feed for an hour. So you can imagine that if a baby is feeding 12 times in 24 hours and they're feeding at the breast for an hour, it can take a lot of time, okay? They do get faster. It very rarely will always take an hour to feed a baby, but when they're very small, they can want to feed very frequently. Okay, so laying down is really a good thing for mums to be able to do while they're breastfeeding so that you can get a little bit of a rest. All right, so a few other positions that mums can use while they're breastfeeding. The most common one, if we ask, parents before they've had a baby, how do you breastfeed a baby? We'll see them hold their arm up like this, as if the baby's head is here. Right? But if you have a look at where the baby's head would be compared to where my breast is here, okay, that's not the direction that my nipples are pointing. So if you want to feed your baby this way, I would suggest that all of you get your baby's head with this arm and then swing your arm underneath. Okay, so it's just one of those things that's a lot of, It's difficult to explain without having a baby there, but hopefully that will make a little bit more sense when your baby arrives. So there's also the football hold. So this can be really good if you've got sort of fairly large breasts that are getting in the way. And that's when you put your baby's head here and your baby sort of goes underneath here. Okay, so the other really great thing is baby-led attachment. Has anyone heard of this before? No? Has anyone heard of the breast crawl? Yes, okay, so it's very similar to the breast crawl, but we can do it for sort of quite a long way after your baby is born. So a baby is born with these sort of natural instincts where they can make their own way to the breast, and it's really quite amazing to watch. There are a lot of videos online that you can watch. If you go onto our website, there's a few on there as well. But it actually helps with positioning and attachment as well. So what happens is when you lay a baby down on their stomach, on your mum, and sort of lay yourself back a little bit, they will instinctively try and make their own way to the breast. They'll sort of start to bob around, and they will use their legs to push up offwards. They've got a reflex called a stepping reflex that helps them to do this. So what that means is that actually gets them to drop their tongue down. When they're face down, that's something that they will start to do when they're bobbing around. So it avoids that sort of tongue that was up that we saw before with the baby crying. So baby-led attachment is really great if you're having positioning and attachment difficulties. Okay, now does anyone want to have a guess at what our number one question we get asked on the breastfeeding helpline is? No? Okay, number one question we get asked is, how do I know if my baby is getting enough milk? Okay, it's all of the time. That's one of the biggest things that mums are concerned about. Is my baby getting enough milk? How am I going to know? All right, so what we need to look at is what goes in must come out. So this is one of these things that if you are a first-time parent, you will get used to talking about your baby's wet and dirty nappies all of the time. So we're looking at 4 to 5 heavily wet nappies. So you sort of hold it in your hand and go, that's heavy. So that's for wet nappies. And you also want to look at sort of the colour and the smell of their urine. Again, I know this is probably just delightful for some of those of you who haven't had a baby yet. But you don't want it to smell really strongly of ammonia, and you don't want it to be a dark colour. So if they've got sort of pale straw-coloured wet nappies and it doesn't have a strong offensive smell, then that's great. And you want their bowel movements to be nice and soft. Okay, range of colours is normal. And it will also look sort of mustardy, and it might have sort of cottage cheese looking curds in it. So that's a normal breastfed baby poo. That's a really important thing to know as well. Okay, so the other thing to keep in mind is that if your baby is getting enough milk, they may come off the breast looking milk drunk, and I'll find you the photo of this, not that one. This one. This is what we call milk drunk, and you can see why we call it that. So this is a baby that's just come off the breast and said, this is the best thing that's ever happened in my entire life. And that's probably true because, you know, this baby's not very old. So, but yes, so this baby, you can quite clearly, you can see from this image, this baby has gotten enough milk. Very happy baby, and you can also see the milk's actually dribbling out of his mouth. So that's another sign of your baby getting enough milk as well. They may have 1 or 2 unsettled periods during the evening. Okay, that's normal, and it's quite common for babies to cluster feed in the evening. So just about the time when you're about to sit down and have your dinner, your big meal for the evening before you go to sleep, your baby might want to do that as well. So they may want to feed on one side and then come back 45 minutes later and feed on the other side. And that just means that they're going to stock up with calories so that they can hopefully get a slightly longer sleep overnight. All right. If anyone does have any questions, do feel free to shoot your hand up and I'm happy to stop. All right, so where to go for help? We have a lot of services that we offer. I did briefly mention our helpline, so 1-800-MUM-to-MUM or 1-800-686-268. It is a 24-hour helpline, and it's a 1-800 number. So everyone that you speak to on our helpline is another mum who has been trained in breastfeeding support counselling. Okay, and we're all volunteers as well, so we answer the calls from our own home around our children. Okay, so we know what it's like. It's quite fine if you want to call us and your baby is screaming in the background. We're all mums. We've all been there where you just have to call. You know, you don't have any other choice. It's totally fine. We're not medically trained, so if you do have a problem that needs medical attention, we will refer you on to a health professional. Okay, so all of this information, as I said, is covered in our breastfeeding education classes, which look like this. Okay, so the breastfeeding classes go for about 3 hours. It's $85 for a class, and that also includes your ABA membership as well. So ABA membership is $65, and that gets you 12 months of membership, gets you a lot of information and support as well. We send you out a magazine once every 2 months, and you get a book called Breastfeeding Naturally, which is valued at $34.95. The classes are really great because you get a chance to do this, which is to watch someone else breastfeed. And that is such a huge and important thing to do before you have your baby. The amount of people that we have tell us that they have never seen a baby being breastfed before they do it, before they have their own baby on their chest, is huge. And if you can imagine learning any new skill, learning to ride a bike, learning to read, if you'd never seen anyone do it before, it's going to be a lot more difficult. So come along to one of our classes. We try and have a demo mum with a small baby at every class. Okay, if you're not able to come along to a class, we do run local group meetings. So you can come along and meet other mums. They will be very happy for you to watch them breastfeed their baby. And we also run information sessions at our local groups as well on different topics. So we will talk about, you know, one week we might talk about expressing and storing. Next week we might talk about introducing solids. And those are run by our volunteers who are qualified or training as well. So we are at the stand over up against the wall, the Australian Breastfeeding Association stand. So you can come over and you can join to be a member. You can book into one of our classes, or we do have some trained volunteers if you have any specific questions. I might throw over, does anyone have any questions they would like me to answer now?